Hi everyone, this is Dr. Mansi back again on the Beyond Boundaries with Homeopathy 360 webinar series. Uh, Today we have Dr. Abhijit Mural on the topic Hidden Gems of Materia Medica Rare Remedies in Hepatic Disorder. A very warm welcome to you, sir. Now let me introduce Dr. Abhijit sir, MD Homeopathic, Ph.D. Scholar, Associate Professor, and Head of Department, Government Homeopathic College and Hospital, Jalgaon. A devotee academician, skilled clinician, and committed researcher, he strives to blend classical homeopathic principles with modern evidence-based practice. His work focuses on chronic disease, palliative care, and nurturing the next generation of homeopaths through inspired PG mentorship and community health service, advancing classical homeopathy through research, education, and compassionate care. Dr. Abhijit Singh has done his Ph.D. scholar from NASIC, MUHS, DKMM, HMC Chhatrapati Sambhajinagar, and now uh, now he's an assistant professor, and he has published various publications on the national and international platform as well. Now we are going to start the webinar on the topic Hidden Gems of Materia Medica, Rare Remedies in Hepatic Disorder. So we are eagerly waiting for your expertise, and we are going to learn from you today, from your experience and your case. So please begin the webinar.
Okay. Thank you, Mansi, for giving a brief introduction of mine. Namaste, all of you. As the time slot is given by Dr. Mansi is of 1 hour, we are not going to wait for other persons. So let me start with introduction of this topic. तब तक के बाकी के लोग join हो जाएंगे. So namaste and welcome. I'm honored to be speaking on the subject that breach the wisdom of stalwarts with subtitle brilliance of lesser known remedies. So I took the topic for today's discussions rather than seminar, that is Hidden Gems of Materia Medica with rare remedies in hepatic disorders. So in the where the polycrest remedy is dominating in prescriptions, and we are solely believe that our polycrest remedies are help to cure the patient, but some hidden remedies which are less food or organ oriented remedies that will also help to cure the patient or to make the recovery faster than that of any sort of remedies, mostly in chronic disease condition. So where the remedy quietly shine in liver pathology, we are going to take introduction at this webinar, mostly focusing on liver disorders. So here we are going to, I'm going to share the PPT for that. Sharing my screen. आपको दिख रहा है? Is it visible?
Yes, sir, it is visible.
So as we know, the today's topic of webinar is Hidden Gems of Materia Medica with rare remedies in hepatic disorders. We know as the lifestyle of our whole country's population and what kind of food we eat, what kind of water we drink, on that basis, the liver disorders are very common in these phases. Okay. So what is the importance of today topic, that if you are not getting some sort of palliation in rare chronic diseases conditions, that rare remedies which are hidden in our Materia Medica, like that of Boric, Kent, then Alan Skino, then Dr. Clark, Dr. Burnett, that remedies having some important characteristic symptoms which are we are willingly to learn from them and their strength. So today topic we contain overall liver review with rare homeopathic remedies, having comparative table of that remedies and what the stalwarts are showing path to you with practical tips and some discussions. In upcoming lecture, I will just want to give brief about why there is an importance of rare remedies in our practice. So, firstly, the learning objective of this webinar is understand the liver pathology from homeopathic lens. That is, most of the symptomatic symptoms we are going to believe and we are taking into the consideration. Explore the remedy which are rare with hepatic affinity and collecting their repertorial totality regarding pathological symptoms which produce or which given in our repertories. Then learning clinical tips from stalwart, that is very enough and very short, and encouraging individual prescription beyond the polycrest. I again clear, taking this topic is to help us to improve our practice and our result in respect with hepatic disorders. So we're taking the liver overview. As we know all, the liver functions क्या है? As the anybody say लिवर फंक्शन कोई बोल सकता है आपके इसमें जितने भी प्रेजेंट है कि ये लिवर फंक्शन है, व्हाट इज द कॉमन डिसऑर्डर्स एंड व्हाट आर द होम्योपैथिक अप्रोच. सो लीवर के मेन 3 फंक्शन है. वी नो द लीवर इज अ स्टोर हाउस ऑफ योर बॉडी. इट गेट डिटॉक्सिकेशन, मेटाबॉलिज्म एंड बाइल प्रोडक्शन. इसके डिटेल में हम नहीं जाएंगे क्योंकि आप लोगों को इसके बारे में बहुत सारी चीजें पता है. फादर आइसिस की आप मेरे से भी अच्छे तरह से उसको समझ सकते हैं. Then the common disorders of liver, that is hepatitis, cirrhosis, fatty liver, and jaundice. So what we take in homeopathic approach, mostly we go towards for polycrest remedy, constitutional remedy, that is with the totality of symptoms. Mostly it covers mental and physical state of that patient. Then next approach is of miasmatic approach, in which that disease condition, miasm is suffer and all, we take the miasmatic totality, and where we don't get all sort of number of symptoms, and we are going to practice, or we are going to give medicine on the basis of organ affinity. As we all know, organ affinity पे बात करने वाले जो बहुत बड़े प्रिस्क्राइबर अपने स्टॉलवर्ड्स हुए हैं, दैट इज Boning Hussain sir, Boger sir, Burnett. So they are talking mostly about organ affinity. So today's topic is what is the importance of rare remedies in liver disorders. Is it clear up to now? Here we show that what is the healthy liver and unhealthy liver. You should know all of this. So what the organon tells us about rare remedies, or this aphorism with rare remedies, that the second point of business of true physician related to acquiring knowledge of the instrument intended for the cure the natural disease. Instrument means what sorts of medicines you have, what sorts of diet regimen you are given to the patient. So second point of business of true physician is acquiring the knowledge, the instrument instead for the cure of the natural disease. So investigation, the pathogenetic power of medicines in order when called to cure to able the select form among them one. From the list of whole symptoms, an artificial disease may be constructed as similar as possible to totality of principal symptoms of natural disease sought to be cured. So what the aphorism number 5 says कि आपको जो रेमेडी जो डिसीज कंडीशन है उस हिसाब से आपको आपके इंस्ट्रूमेंट्स को, आपके मेडिसिन को, आपके अवेलेबल सोर्सेस को यूटिलाइज करना है. So that's why we are always not depending on polycrest remedies or rare remedies or keynote symptoms and all. It's always a holistic approach that's called a classical homeopathy or any sort जहाँ पे जो चीज का utilization है वहाँ पे we have to utilize that. So we are going to take our main part of rare remedies in detail. So first, rare remedies, which I have to use or I regularly use in practice, and most of the results related to the liver and gallstone or hepatic disorders, that is Ceonthus virginica. So these are some few symptoms which are important for prescribing, that is bruise, soreness, or eyeballs, etc. There bruise and soreness, pain in the liver region and eyeball. Pain ascending from forehead to stomach, which acts periodically. Nose pressure at squeezing with bilious sickness, headache on the beach. That is another symptoms of hemophilis 2. Tongue appear, which is greenish yellow, but feel brown up. What is the vomiting character of these remedies? The vomiting is bitter, sour, hot, bilious, roughy, gushy, setting teeth on the edge with colic and cold sweat, forehead, back, and the hand. That is uneasy ache in the liver with cholecystitis at the navel pin, as if bond about abdomen, weakness in gallstone with gripping hypogastria. So stool character is tiring, clay color, and undigested. So these are the symptoms of Ceonthus virginica, which other associate symptom, that is jaundice with heat and aversion to uncovering back on hand. These are the characteristic symptoms, and having in female there is arrested menses with the liver disorders. So the Ceonthus, which is used in jaundice condition where heat with aversion to the uncovered part. I go through the repertory and found some interesting symptoms about Ceonthus, which I take only liver symptoms. So if you go through a repertory and take help of that, so it is says that the abdomen, cancer, liver having 1 mark, along with cancer, liver, gallbladder. The references are there another. Vomiting in general, which is green. Vomiting in general is sour. There is a atrophy of liver. Then next, abdomen enlarged, liver, malaria with. Then abdomen enlarged having spleen enlargement. Abdomen enlarged with chronic liver diseases. Then inflammation, peritonitis, enteritis. So what I say is कि जो अपन पॉलीक्रेस्ट रेमेडी के बारे में सोचते हैं वही सिम्टम्स आपको रेयर में भी है. You have to search for that. If we individual extract the Ceonthus, that is 1, 2, 3, 4 symptoms are found. That is 12 1,234 symptoms are there in repertory with mind section, and all the other compartments are taken consideration. Out of them, I am only taking the liver symptom as our topic is about liver. So this is what we are going to take in consideration while prescribing, or not depending upon only the polytheist. So this is the first remedy. We have to think about rare diseases condition, that is Cyneonthus virginis. So next remedy, which one be there? Anyone? आप लोगों को बहुत सारी रेमेडीज पता रहती है, लेकिन कुछ रेमेडी ऐसी है कि उसपे अपन उसका यूटिलाइजेशन ही नहीं करते इन प्रिस्क्रिप्शन. सो फर्स्ट वन वाज Cyneonthus virginica. Then next one is Lepandra virginica. So in this remedy, Dr. Boger, in their synoptic key, they says that the affected region is liver, aggravation, cold drink and motion, better by laying on stomach, side or right-sided remedy. So there is a hepatohemorrhagic diathesis. What is the character of pain? Burning in hepatic region. At the mind level, they are hopeless and having craves for ice drink. So hopeless in the sense of they don't feel that they are not recovered from this disease condition, and having extensive craving for ice drinks. So I'm talking about Lepandra virginica. So having bilious vomitus, sore and dull, weak, drowsy, rusty ache all over the gallbladder or liver region, down over the bowels to nowhere, or towards left scapula or along the spine. So this is the pain characteristics of Lepandra virginica. Liver swelled transversely regions मध्ये the liver gets swelled and having acute liver condition like gallstone. They are indicated in acute liver conditions and in gallstone too. So what is the character of stool? That is, stool is starry with black foul, stringy, waxy, with muddy, watery, and having morning session. जैसे morning diarrhea बोल सकते हैं, वह morning stool में उनका character ऐसा रहता है. Means sprouting with pain at the navel, dysentery after diarrhea. So there is a dysentery condition mostly after diarrhea. Having prolapse, piles with hemorrhage, leukorrhea in female with warm, watery runs down the limbs. It is also indicated in sciatic nerve pain, when mostly aggravation in seating, and nail were thin, soft, and splitting, and is also indicated in jaundice. So Lepandra virginica has been complementary to the phosphorus and related to the cardusmus and Cyneonthus and bapticium. So this is the remedy which is used by Dr. Boger sir, mostly in liver condition. अगर आप इसको रेपर्टराइजेशन लैंग्वेज में आप रेपर्टरी से उसके रूब्रिक निकालेंगे, सिंगल रेमेडी रूब्रिक, एज आई सेज अर्लियर की बोगर सर ने होपलेस उनको बोला है, होपलेस अबाउट डिसीज कंडीशन की दैट इज not be cured. So here we found 43 symptoms of Lepandra and having mind symptoms of sadness, depression, melancholy, in liver troubles in there. Especially mentioned that कि melancholic condition in the patient who is suffering from liver disease. So here is another symptom, that is indigestion complaint with atrophy of liver. It is also indicated in liver congestion, liver cancer, portal liver congestion, chronic liver congestion, and fullness of liver region, heaviness as if load or weight on the liver, I mean inflammation in peritonitis, enteritis, liver hepatitis, जर आपल्याला peritonitis and enteritis के symptoms मिल रहे हैं, तो that time lependra is the remedy of choice. So here other next slide or जो नीचे में symptoms लिखे abdominal pain, liver stool after, pain extending to back, pain extending to shoulder, pain extending to shoulder mostly left, extending to spine जो जब symptoms के बारे में बताया था तब. So it is also one symptom that sleepiness with liver troublesome. And clinically, it is indicated in dropsical condition with liver diseases. And in female, there is a menses liver complaint with. And having rectum, diarrhea in general with liver complaint with. So what I am going to focus or what want to tell you people that rare remedies have abundant number of symptoms where the minimum we can get with the help of mind and pathological symptoms too. So this is the second important rare remedy which are not going to use regularly for liver troubles. So आपने इसके indications देखे हैं from cancer to hepatitis to gallbladder stone, सभी disease condition में hepatic conditions में lependra का utilization. Then next remedy you may all over to know, आप सबको पता भी होगी इसके बारे में, बहुत से लोग use भी करते हैं इसको, that is Phelthori. It is well-known remedy in homeopathic where the peristaltic action on intestine करता है, influences the fat and increases and it is duodenal secretion. What is its pathogenicity? That liquefies the biles and acts and purgative as a collages. So disorders digestion, diarrhea, pain in the nape of neck among the chief complaint. It is mostly indicated in obstructive gall duct with biliary calculi and jaundice. So fail theory is most of the time all patient, all physicians should be known about this remedy. So his stomach symptoms are eructations, gurgling in stomach with epigastric region and having violent peristaltic movement with tendency to sleep after eating. What is the keynote symptom of fail theory? That patient has a tendency to sleep after eating. It is mostly used in lower trituration as the Boris says. So when I go to repertorial symptoms for fail theory, that is mind, business desire for, they are busy and irritable. Mind, nose, sulky, cross, fretful, inhuman, and peevish. One of the remedies is Phil and having abdomen, cirrhosis of liver. It is indicated in cirrhosis of liver. It has I found only 3 symptoms of Phil theory. That is indication cirrhosis of liver. When in the condition of cirrhosis of liver, the person having बिजनेस डिजायर को काम करने की बहुत ज्यादा इच्छा होती है, दे वांट टू बी बिजी ऑलवेज, दो ही सफरिंग फ्रॉम दैट इरिवर्सिबल पैथोलॉजिकल कंडीशन, दे आर ऑलवेज डीलिंग विन बिजनेस और सब खुद को बिजी रखता है, तो दैट पेशेंट के लिए आप फेल थ्योरी के बारे में सोच सकते हैं. सो इट इज लिवर कोलिक एंड हैविंग गॉल स्टोन. देन नेक्स्ट जो रेमेडी सबको पता है उसके बारे में ज्यादा मैं डीप में नहीं जाना चाहता हूँ, बिकॉज कार्डस मैरिनस इज द वेल नोन रेमेडी फॉर लिवर डिसीजेस कंडीशन. It is mostly what I want to focus on, that one keynote symptom, that is it is indicated in abused alcohol beverage, that is of especially beer. So this is, जैसे अपने सबको पता ही है, मोस्टली इंडियन पीपल्स आर गोइंग टू ड्रिंक बियर एंड ऑल, दे आर abusing that wine on beer conditions. So if any person who is chronic alcoholic and suffering from liver disorders, you may think of Cardus marinus. and you regularly says that it disturb regular sugar metabolism, having debility and hemorrhage, especially connected with hepatic disorders. Their mind is also forgetful, static, and dysfunctional. So this is the regularly used remedy and well-known remedy for liver disease condition. I'm not going to go in detail about that. So next remedy, which I think we are not going to take it seriously for a prescription, that is Myrica Sepera. Again, this remedy is given in bogus synoptic key. Their affected region is liver and heart. It is better in open air. That patient is better in open air. Their mind, they are very discouraged people. Having dull headache in early morning, yellow sclera, very red eyelids, combined liver and heart symptoms. So liver affection with dull pain, with pain under either scapula, with urticarial rashes, and having jaundice, and mostly it is indicated in jaundice of infants. So fullness and burning in gallbladder. Their mouth, that is, and all the discharges are foul and having adhesive mucus in mouth, throat, or stool, and their pulse are very slow. Complementary for a digitalis and calibicromicum and compared with chilibum. This is one of the important remedy, and we regularly miss such remedies for prescribing because of the constitutional remedies helps us. But if that is not going to get cured, that time you may take the help of these rare remedies, that is Myrica cerifera, which is given in synoptic key of Materia Medica by C.M. Bogle. So when we go for their mental symptoms or liver symptoms of this myristica, we found that the 23 symptoms, that is abdomen, cancer, liver, liver cancer, it is indicated. Then having jaundice with liver cancer, fullness of liver, जो भी symptoms आपको मिलते हैं, what I'm trying to say is कि ये जो rare remedies है, they have also abundant number of symptoms when are we going to select with the help of repertory. But provided that the repertory, as we know, that the repertory is a tool only. So we have to select the proper rubric selection with proper remedy. और रेपर्टरी में ऐसा कहा गया नहीं है कि आप पहले नंबर की जो रेमेडी आई उसको ही प्रिस्क्राइब करो. वी हैव टू टेकन ग्रांटेड फॉर ऑल द टोटलिटी ऑफ सिम्टम्स. कौन से सिम्टम्स वहां पे जितना ज्यादा रेमेडीज ने कवर किया है उस हिसाब से आप उसको प्रिस्क्राइब कर सकते. सो हैविंग स्किन इरप्शंस with urticarial hues in liver symptoms with. Okay. So this is another remedy. आपने इसके पहले भी रेमेडी में जो देखा था, आई थिंक एक रेपोट्रियल का सिम्टम्स था, sleepiness, liver trouble, and then we again found that symptoms in Myrica coffea too. That is sleep, sleepiness, liver trouble in. So this is what the rare remedies we are going to be considered. Okay. Then next remedy, we all know, that is Crotalus horridus. There is hemorrhagic tendencies with liver degeneration. जब भी liver diseases में hemorrhagic tendencies आती है, we should think of Crotalus horridus. It is worse in modalities. काफी अच्छा Materia Medica इसका अपने पास है, बोरगर में है एंड अदर बोरिक रेमेडी, बोरिक में है. बहुत सी मेडिसिन के बारे में इंफॉर्मेशन भी है. दे हैव एक्ट एज ए कॉन्स्टिट्यूशनल वन, पूरा रेमेडीज दिया है. बट व्हाट द क्लिनिकल पर्ल बाय केंट, डॉक्टर केंट, इट इज यूज्ड इन सेप्टिक लिवर कंडीशन. मोस्टली वी नो कि केंट सर कभी ऐसे सिंपल रेमेडीज के बारे में बोलते नहीं कि दिस इज द क्लिनिकल इंडिकेशन ऑफ दिस रेमेडीज, but Kent is used this remedy. It is in septic liver conditions. So that's why I took these remedies in for rare known symptoms. So when we found the Crotalus horridus, they're in mostly root of liver symptoms, because this seminar is of only on liver disorders, जो hepatic disorders है उसके बारे में है. So after taking totality, I am focusing on liver disease symptoms only. So here, Crotalus horridus, it is indicated in atrophy liver. Only one remedy, 1 mark के लिए 41 remedies है उसमें. उसमें one remedy is this. And in stomach symptoms, having general laying down aggravation, side on right liver complaint in. So Crotalus horridus is the one the remedy out of two that there is aggravation on sleeping on right side. Patient is not able to sit on the right side with liver complaint. Having congestion liver, heart disease in. There are 3 remedies, out of which Crotalus horridus is one of them. Then other symptoms are there. There is a pain, liver breathing on, abdominal pain in liver extending to the shoulder, abdomen pain, liver extending to the shoulder right. इसके पहले एक रेमेडी देखा था आपने जो आपको याद होगी, तो उसमें लेफ्ट शोल्डर में पेन जाता है. देन एब्डोमेन पेन, स्टिचेस, स्टिंकिंग एक्सेट्रा इन liver. That is number of remedies more, but the symptom number 8, that is pain in hypochondria right side, which extending to the scapula, top of the liver, only extending to the scapula, top of the liver, is only one remedy, that is Crotalus horridus. 1 mark के लिए. So these are the symptoms where we are going to take that any sort of keynote prescription, or if we find uncommon peculiar symptoms, that time these remedies are magically work. So let's think about small remedies which are given in the boric or synoptic key with other constitutional or polycrest remedies what we see. So I think any question about these 4, 5 remedies, if you have any question or your interaction for that, so I can get clear at this time. मानसी जी, किसी को कोई पूछना है इस चीज के बारे में, तो फिर अपन यहाँ पे क्लियर करके आगे बढ़ सकते हैं. बिकॉज वी आर रनिंग टाइम शॉर्ट, तो आगे जाने के पहले अगर थोड़ा कुछ किसी को डिफिकल्टी होगी अब तक के टॉपिक में या फिर रेमेडीज के अंडरस्टैंडिंग में, वी गेट क्लियर. या आखिरी में रखते हैं. हेलो.
Thank you, sir.
हेलो.
Yes, sir.
लास्टली रखते हैं सब क्वेश्चन आंसर.
Yes, sir, sure. So, anybody from the audience want to ask any query?
About up to
Relate-
this, that so we can clear one by one. That's why I am asking about that. क्योंकि एकदम हर एक क्वेश्चन के बारे में पूछना शुरू हो जाएगा, हर एक रेमेडी के बारे में पूछना हो जाएगा, तो फिर दैट इज डिफिकल्ट टू क्लियरिफाई द ऑल द रेमेडीज वेरी.
Yes, sir. So, any question till TEDx account? You can write your question in question and answer box.
In chat box.
Yes.
Question answer box. So okay, we are going to continue about the next remedy, which is
Yes, sir.
Taraxum officinans. So again, एज वी नो ऑल, इसके काफी अच्छा मटेरिया का अपने पास मिला है। आपके पास मटेरिया के बहुत सारे सिम्टम्स डायरेक्शन के बारे में बोरिक ने अच्छी तरीके से डिस्ट्रीब्यूट किया। आई एम ओनली टेकिंग सम सॉर्ट ऑफ व्हाट इज द इम्पोर्टेंट ऑफ डायरेक्शन इन लिवर condition, that is it is indications are bitter taste with MAP term and having sluggish liver. लिवर फंक्शन जो स्लो कर लेता है, इसमें बीटर टेस्ट प्रोड्यूस होता है। दीज आर द कैरेक्टरिस्टिक सम ऑफ सिम्टम्स। आप डिटेल में जाएंगे तो आपको किताब में मिलेगा। बट व्हाट व्हाई आई दिस टेक रेमेडी एज अ रेयर एंड प्रिस्क्रिप्शन, बिकॉज clinically Dr. Clark says it is noted its use in hepatic dyspepsia. So this is the stalwarts in notification, that is it is used in hepatic dyspepsia. And if we go through the repertorial symptom of this remedy, as taken that mental sadness, melancholic रहता है, worse cold open and better warm. You may take the help of boric to take all the symptoms or all the information of paroxysm, and in Clark dictionary too. So I am focusing on that liver symptoms of paroxysms. We found 17 symptoms. Okay. So of these 17 symptoms, the symptoms are stomach pain, stomach with indigestion and in liver complaint with. There are 4 remedies. Out of this, paroxysm is one, and having one common peculiar symptom, that is ascites, liver complaint with obstruction. So I think some sort of. So that is the symptom number C. That is, it is indicated in dropsical condition, that is ascites with liver complaint and having obstruction. One single remedy is direction. Then बाकी के जो रेमेडीज है उसमें नंबर ऑफ रेमेडीज बहुत ज्यादा है, सिंपल दो. व्हाट इज द डॉक्टर क्लार्क सेज अबाउट paroxysms, that is it is used in hepatic dyspepsia. So let me reminder one thing कि अगर आपको सिंगल रेमेडी सिंगल रूब्रिक मिल रहा है और उसमें की नोट प्रिस्क्रिप्शन आपके पास टोटलिटी ऑफ सिम्टम्स में मेंटल सिम्टम्स में मैच हो रहा है, और आप इन्वेस्टिगेशन जब कर रहे हैं तो उसमें सीधा सीधा आपको ऑब्स्ट्रक्शन इन लिवर विथ लिवर कंप्लेंट दिख रहा है एंड हैविंग फॉर्म ऑफ ascites, dropsical कंडीशन with enlarged liver, hardness in general abdomen में आता है. That is common symptoms also. पेन लीवर में है, उसके बाद प्रेसिंग टाइप ऑफ पेन है, गॉलस्टोन कोलिक है, then portal congestion that patient having form. That time paroxysmus is the one remedy which you think of, having sensitiveness to the liver region with tenderness. It is indicated in general swelling of the liver too, and having dropsical from liver diseases. Dropsy from liver disease. Clinically, if you going to put the symptom that is dropsy liver disease with, so one of the remedy is paroxysm. The next remedy which we know very well, and you I mean बहुत बार आपने इसको यूज किया है, but it is used mostly in hepatosplenic splenomegaly. Okay? That is, this remedy is mostly indicated in splenomegaly, which it is called as Synonthus americanus. But what is the practical use, or practically where the spleen and liver both get enlarged, or hepatosplenomegaly with the previous history of suppressed malarial condition, और मलेरिया वो पेशेंट को रेगुलरली होता है, लीकेमिया है या फिर एनीमिक कंडीशन है जहाँ पे लिवर एंड स्प्लीन में inflammatory enlargement होता है, that time Sinanthus americans is the remedy of choice, and you take the help of this remedy for curing that patient. So, having uncommon peculiar of constant urging to urinate with green for the urine, having contains biles and sugar. So, whenever we get the investigations report and having such a type of urine report having a patient having bile and sugar content is there, and having along with what the symptoms I will tell, that is anemic patient with past history of recurrent malarial fever, that is abuse cake of malaria is the causative factor for that, and along with liver there is a hepatomegaly of spleen, a hypertrophy of spleen. So, hepatomegaly and hepatosplenomegaly, when there is a condition of this disease, when we are going to consider that time, Srinivanthus americans plays a major role to cure that the obstruction, the clear and form the healthy cells in liver as well as in spleen. So, what are the rubrics of Sinonthus in liver condition? As I earlier says, this remedy has more action in spleen. So it is indicated mostly in condition of liver along with spleen. अगर कोई कंडीशन ऐसी आ रही है पेशेंट में स्प्लीनोमेगैली भी है along with hepatomegaly or fatty liver or any disease condition which related to liver, that time Sinonthus is the remedy which is used in both parameters. So, abdomen, pain, liver, it is generalized rubrics are there. There is no specific single remedy rubric are found in Sinonthus. But if we taken consideration into the liver complaint, that is predominant, sorry, spleen complaint, that is predominantly spleen remedy. But along with that, if that patient is suffering from liver complaints to having dropsy due to liver disorders and swelling, congestion, that time Sinonthus is also plays a major role to cure these disease conditions. These are the number of remedies where we are going to take into the consideration. So one by one we call the remedies which are rarely used, and we may know few of them and we may not know about that. So first remedy which I am going to revise you because some people are joined lately. So Sinionthus virginica, it is one remedy. We go to the Materia Medica of that remedy and take consideration and prescribe it for cancerous liver condition, mostly gallbladder के वजह से liver में cancer हुआ है, cirrhosis of liver में भी having constriction feeling, enlarged abdomen, तब आप उसको utilize कर सकते हो. Enlargement of liver and liver enlargement, mostly malarial complaint. There are two remedies. One of them is the Shinionthus. Then next remedy which we take, that is Lepentandra virginica. This remedy is having hepatohemorrhagic diathesis and having black, foul, tarry or black stool with dysentery after stool and having reportorial symptom, that is cancer liver. It is indicated in indigestion liver complaint with. There are 4 remedies out of one is Lependra, then fullness liver and all symptoms. And one symptoms which is I am going to focus for this remedy is abdomen, pain, liver extending to the spine. Only one remedy. And then next one is abdomen, pain, liver extending to the shoulder, mostly left. तो 2 रेमेडी इसमें दिए गई, उसमें से एक लेपेंड्रा है. देन अगेन एब्डोमेन पेन कैरेक्टर्स में स्मार्टनिंग लिवर एक्सटेंडिंग टू द स्पाइन, जो स्मार्टनिंग पेन बताया है, यहाँ पे सिर्फ पेन एक्सटेंडिंग टू द बताया इसको, और स्पेसिफाई किया गया है। उसके बाद बर्निंग स्मार्टनिंग कांस्टेंट एट द लीवर। तो पेन कैसे है, बर्निंग है, स्मार्टनिंग है विथ कांस्टेंट इन लीवर रीजन, ओनली वन रेमेडी इज लेपेंड्रा। देन नेक्स्ट, failure, as we all know, it is also given in for gall duct biles में जो अगर स्टोन हुए हैं तो उसको liquefies the biles and acts the purgative for the colleges. Then violent peristaltic movement with tendency to sleep after eating. This is the keynote prescription symptom for failure. And when we go for symptoms, it is mind business desire for in a liver disease condition. If patient having tremendous desire for business, they are suffering from cirrhosis of liver sort of diseases, and not going to bother that ki this such conditions is affected me and I am going to do my work and all. The field theory is the one remedy which is taken for consideration. Then we all know Cardus Marianus, and mostly abuse of alcoholic beverage with special beer, especially the beer जिसमें होता है, और having hemorrhages specially connected with hepatic disorders. इसका काफी ज्यादा यूज सब लोग करते हैं इन प्रैक्टिस, और सबको यूटिलिटी पता है, नॉट गोइंग टू फोकस इन रिपोर्टेड सिम्टम देखे तो बहुत ज्यादा निकलेगी उसको. Then the most important remedy, what I think we are not going to take consideration, that is Myrica cerifera, liver affection with dull pain and having urticarial eruptions. अगर आप उसके रिपोर्टेड सिम्टम देखेंगे, 23 symptoms are there. उसमें abdomen, cancer, liver, jaundice with only one remedy and having 1 mark for there. उसके बाद abdomen, liver, urticaria with, there are 4 remedies and one of them is Myrica. Then next symptom which is पेन एक्सटेंडिंग टू द शोल्डर लेफ्ट, जो अपन ने सबसे पहले रेमेडी में देखा था. दूसरी रेमेडी है मायरिका. देन अदर कॉमन सिम्टम्स आर देयर, एंड सिंगल रेमेडी में स्किन इरप्शन, अर्टिकेरिया, ह्यूज, लीवर सिम्टम्स विद. सो 3 रेमेडीज उसमें आती है, उसमें से एक रेमेडी इज मायरिका सेरी. This is what I am going to focus on. Then again, Crotalus horridus, Crotalus horridus, where the Dr. Kane sir says it is used in septic liver condition and having fear of death, having loquacity as the snake group. And when we go for their liver symptoms, we are find 15 symptoms in there, and it is indicated in keynote symptom as stomach, vomiting, general, laying, aggravation, side on, right, that is liver complaining. There are only 2 remedies, and one of them is Procalus horridus. Then hypochondriac pain, which is right side, extending to the scapula, top of it and liver. There is only one remedy, that is Crotalus horridus. And next symptom is congestion in liver with heart disease in. There are only 3 remedies. Out of them, Crotalus horridus is 1 mark. So this is another important remedy. Then last, where we Sinionthus, जहाँ पे आपने देखा था कि most of the time these remedies are of splenomegaly, spleen उसमें active action ज़्यादा है Sinionthus में. But when the hepatosplenomegaly condition is found, that time Sinionthus is the remedy of choice for prescription. Then other remedy, which is Podophylla petalum, we know all its functions and all the characteristic symptoms are well, morning diarrhea, liver toxicity. Then why I choose this remedy as a rare, that is Dr. Allen's emphasize its role in gallbladder dysfunction. So, podophyllum, all we know what are the characters and all, but in gallbladder dysfunctioning, Dr. Allen's it prescribe it regularly. Then next one is I am going to cut short that Synionthus, Portulus orgidus, Leptindra, Synionthus, Parascum, Myrica, Podophyllum, Felthuris, एक शॉर्ट फॉर्म में आपको टेबुलर फॉर्म में बताया लिवर इंडिकेशंस क्या है उसके मॉडलिटीज मेंटल स्टेट एंड रेफरेंस कौन से बुक से लिए गया है विच स्टॉलवर्ड सेइंग दिस रेमेडी इज यूजफुल इन दिस लिवर कंडीशन दैट इज first is Chinianthus, that is jaundice, bilious headache, worse morning, irritable, and it is stalwart's reference is Dr. Farrington. Then Crotalus horridus, as we know, hemorrhagic liver condition. Dr. Kent ने जो मैंने बताया था आपको उसके पहले slides में. Then Leptendra, that is black stool with liver pain. Dr. Nash having give the importance of this remedy in liver condition. Synonthus, that is hepatosplenomegaly, where Boric says specifies this role and giving focus on these remedies. Paraxma, Paraxcum, map tongue with bitter taste and having melancholic. Dr. Clark explained its role in liver disease conditions is very well. Myrica, having coated tongue with jaundice. Dr. Hearing focus on this remedy for using in liver condition. Podophyllum, Dr. Allen, as I lastly says, ki Allen says emphasize his role in gallbladder dysfunction. एंड फेल थ्योरी का जो बाइल डिसफंक्शनिंग में लिवर इंडिकेशंस बताया गया है प्रैक्टिकली दैट इज फ्रॉम डॉक्टर बर्नेट सर सो दिस इज व्हाट अबाउट द टॉपिक देयर आर सम रेमेडीज other than these which are also rare and what is indicated in day-to-day practice but somehow these remedies practically used in some disease condition so I have to share some their indications and their utility in liver disorders. So anything to ask about up till the which we having 5 minutes to left. With maybe participant, if you want to ask anything, we are ready to give our opinion or want to share your knowledge. Otherwise, we go forward. So, any question answer in that question answer section, Mansiji?
Yes, sir. So, sir, Divyasri is asking, sir, can Lipendra use for portal vein blockage? Any other questions from the audience?
So, whenever we are going to choose a rare remedy, that disease condition is one of the criteria, as we all know. कि this is the disease condition जहाँ पे उसके बारे में लिखा गया है कि bilious vomiting है और portal congestion के बारे में पूछा गया ना what is the questions please repeat.
Yes, sir. Sir, can Lipendra use for portal vein blockage?
So we are always thinking that if that patient having that sort of symptoms which is matched to that remedy and keynote symptoms are covered by that symptoms. जैसे for example लेप्टेंड्रा में आपको कीनोट सिम्टम्स में मिलेगा morning stool which is black and tarry with foul stringy waxy in appearance and having pain in navel's region and having dysentery of dysentery after diarrhea and having what do I say जो कीनोट सिम्टम है उसमें दैट इज the patient feels hopelessness. As we go through the repertory also, having 6 remedies with liver troubles, उसमें 3 मार्क के लिए लेपेंड रहा है, having sadness, despondency, depression, melancholic, and in liver trouble in. It's covered a 3 mark and having only 6 remedies. You have to judge that symptomatology rather than disease condition. Other physical symptoms which are occurred in that patient, that should be covered too, because not only one remedy that Lependra is for hepatic, what we said, portal congestion. You may think of this remedy when the other symptoms are of that patient is covered. Okay.
So another question we have,
Yes.
Dr. S. Janani is asking, what can we do if patient has hepatitis B virus positive?
Okay. So as we know, any condition or where we prescribe the remedy, and mostly in viral disease conditions, we are going to take the consideration of Hahnemann's acute and chronic disease classification. यहाँ पे आप acute condition, जैसे mostly viral disease conditions are acute one. So whenever you going to prescribe, please go for keynote symptoms or the symptoms which are observed by you in patient. क्योंकि आप डिसीज पे काम करना नहीं चाहते हो. डिसीज द वायरल हेपेटाइटिस है, हेपेटाइटिस बी है, ये सब पता है, लेकिन उसके सिम्टोमेटोलॉजी क्या है. इसीलिए तो हमने जब एक टॉपिक लिया था तो उसके अलोंग विथ मटेरिया मेडिका के साथ इतने सारे रेपर्टरियल सिम्टम्स आपको शेयर किए. Unless and until you are not going to take proper way to selection of the remedy, your rare remedies are not going to help you, and your constitutional or polycrest remedies also have limitations. So whenever you are going to take any disease condition, please go through Materia Medica and confirm that symptoms are there in patient, so that it helps that patient to recover it from their disease condition. Okay. You have to match the symptom of that patient with that disease, with that remedial symptoms. जैसे आपने सिर्फ बोल दिया कि वायरल हेपेटाइटिस है, हेपेटाइटिस बी है, उसके लिए ये रेमेडी है क्या, तो ऐसा नहीं है. यू हैव टू टेक सिम्टम्स विच आर अनकॉमन पिक्यूलियर सिम्टम्स. आर यू बिलीविंग दैट कि देर आर अनकॉमन peculiar symptoms in every individual on which the homeopathy is based? So you have to individualize that patient while taking the consideration of rare remedies too. ऐसा नहीं है कि रेयर रेमेडीज का नाम बोल दिया, हिपेटोस्प्लिना मेगेलिया दे दो. अलोंग विद दैट डेरिवेशन भी आपको देखना पड़ेगा, उसका टोटलिटी क्या आ रहा है वो भी देखना पड़ेगा, और कितने सिम्टम्स उसमें मैच होते हैं वो भी देखना पड़ेगा. इज इट क्लियर? एनी क्वेश्चन? सो जो अभी क्वेश्चन पूछा गया था उसके रिगार्डिंग ही मैंने प्रैक्टिकल टिप्स नीचे में दिया है. उसके पहले बताता हूँ. डॉक्टर विथलकर सर सेज द रेमेडी मस्ट मैच द डीपेस्ट लेयर ऑफ द पेशेंट्स पैथोलॉजी. इवन डॉक्टर शंकरन says even the rarest remedy can be the simillimum if the totality demands it. What it says कि आपको रेयर रेमेडीज भी यूटिलाइज करना है तो यू शुड फॉर्म द टोटलिटी ऑफ दैट रेमेडी ओनली. दैट इज नॉट कि आप एक सिंगल डिसीज कंडीशन को लेके डायरेक्टली प्रिस्क्राइब कर सकते हो. यू हैव टू मैच द सिमिलिमम विद दैट रेयरेस्ट रेमेडीज टोटलिटी. द मास्टर फारूक मास्टर सेज this is कि never ignore the small remedies. They often hold the key to the chronic disease, chronic cases. Okay? जितनी भी छोटी छोटी रेमेडीज अपने पूर्ण मटेरिया मेडिका में दिया है, उसमें जो छोटी रेमेडीज है वो कभी कभी आपको वो क्यूअर के लिए दरवाजा खोल के दे देता है. द मास्टर फारूक says, फारूक मास्टर says. So these are the legendary prescriber where they says ki never being ignore the small remedies. They often hold the key to the chronic cases. Shankaran says ki even rarest remedy can be the simillimum if the totality demands. What the previous question is asked about कि हेपेटाइटिस बी के लिए अपन ये कर सकते हैं क्या, रेमेडी को कोई रेमेडी सोच सकते हैं क्या. प्रोवाइडेड दैट आप रेमेडी कोई भी डिसीज कंडीशन के लिए सोच सकते हो, रादर दैट इट शुड बी मैच in simillimum. Though the rare remedies have rare symptoms and small symptoms of said, that should also come into the totality. कोई रेमेडीज में जैसे टैरेक्सन में देखा था अपन, टंग है, आपको वो सिम्टम्स मैच करने पड़ेंगे. ओके. And remedy must match with the deepest layer of the patient pathology is what Dr. Voithalkar sir says. And deepest pathology के ऊपर अगर आप कोई किताब में जाना चाहते हो, if you want to find the rare remedies utility, so go through Dr. Burnett's Best of Burnett उस किताब. Then Synoptic of Materia Medica where number of remedies are there with target organism के हिसाब से दिया है. So it is clear. So practical tips, that is use the repertory for confirming the rare remedies. Always consider mathematic background. Don't hesitate to go beyond polycrest. We have the hesitation that कि ये polycrest remedy है, इसने तो इतना ये किया नहीं है, तो फिर ये remedy क्या कर सकती है? Let's try. If that totality match with that your patient's totality simillimum form हो रहा है, तो you must take the rare remedies help to cure that patient. And having observed the organ affinity, always while prescribing the rare remedies, you should observe the organ affinity with modalities, which must to be taken consideration while prescription. As we sir says that he Shankaran sir says that he simillimum is must for totality and for prescription. So these are the practical tips while selecting rare remedy. You has to work more harder than that of the polycrest remedy, what I feel. Okay, anything?
Yes, sir. Thanks so much for this wonderful explanation. Next, we have Satyam Gupta is asking how much
Okay.
important the diagnosis is to select rare remedies.
Yes, that is good question, Satyam. Because we know the books where direct diagnosis was given. पोर्टल कंजेशन है, लीवर में सिरोसिस है. देखो, जब आपको डायग्नोसिस प्रॉपर कोई रेमेडीज डिसीज का मिलता है, तो यू नो द डेप्थ ऑफ दैट डिसीज. जैसे इसके पहले ही मैंने आपको कहा था कि ऑब्जर्व द ऑर्गन एफिनिटी एंड कंसिडर द माइजमेटिक बैकग्राउंड. आपको डिसीज डायग्नोसिस पे क्या समझ में आ रहा है कि विच माइजम वी हैव टू गेट ट्रीटेड. वो पेशेंट का माइजमेटिक डायग्नोस, आपका डिसीज डायग्नोसिस आपको माइजम बताता है, उसकी डेथ बताता है, उसके बाद उसकी रिकवरी के चांसेस कितने हैं. ओके, इट इज मोस्टली अन रिकवरेबल है या क्योरेबल है या नॉट क्योरेबल है, उसकी पैथोजेनिसिटी डेप्थ कितनी है, ये सब चीजें आपको डायग्नोसिस पे हेल्प होता है. और जब टारगेट ऑर्गन के बारे में आपको पता रहता है और उसके बारे में आपकी एफिनिटी और सब रहता है मेडिसिन का, तो प्रिस्क्रिप्शन इज वेरी इजी. जैसे मैंने आपको जब इस रेयर रेमेडीज में सियोंथस के बारे में बोलता हूँ, चियोंथस के नहीं, सियोंथस के बारे में, that is its most action is on spleen. Okay, if you are the patient with diagnosed hepatosplenomegaly, then you must think of Sionthus while prescription. So diagnosis helps in prescription because most of the tollwards who believes in pathological condition, that is Dr. Boger sir, then Borik sir, they write their clinical experiences and disease condition in their disease symptoms, rather than you have to correlate it with that disease condition, common and uncommon peculiar symptoms. उसके बाद we are going to prescribe that remedy with the help of our materia medica by forming totality and simillimum to that case. There may be rare remedy, there may be a polycrest remedy. Whenever you prescribe any remedy, their affinity should be there. Organ का वहां पे action चाहिए ही चाहिए. Is it clear?
So any other questions? So we have other questions too. So should we, sir, proceed?
Yeah, it's okay.
Like Ashish is asking, how do you decide whether to start treatment with a deep acting constitutional remedy or a specific liver remedy?
Where to decide, it is the way. If there is a chronic disease condition when the patient is suffering from more, and you have to decide the patient to get its recovery back, आपको उसको recovery पे track पे लाना है, और आप अगर सोच रहे हो कि योर कॉन्स्टिट्यूशनल इज डीप एक्टिंग रेमेडी, ये इसके पूरे ऑर्गन पे डायनामिक लेवल पे एक्ट कर रहा है और आप उसको कितना रिलीफ दे सकते हो, उसमें आपका अश्योरेंस नहीं रहता है एज ए फिजिशियन, और स्टेजेस रहते हैं हर एक डिसीज कंडीशंस में, फर्स्ट सेकंड थर्ड फोर्थ. दोज पीपल हु आर प्रिस्क्राइबिंग ऑन कॉन्स्टिट्यूशनल बेस ओनली, दे आर नॉट बिलीविंग कि रेयर रेमेडीज आर हेल्प्स. बट व्हाट द स्टॉलवर्ड सेज कि remedy must match the deepest layer of the patient's pathology, and स्मॉल जो रेमेडीज रहते हैं, जैसे फॉरेस्ट मास्टर सर आपने सुना होगा बहुत बार सर को, तो उनका जो रहता है कि स्मॉल इग्नोर रेमेडीज जो रहती है वो की रहती है क्रॉनिक केसेस को ट्रैक पे लाने के लिए. ओके, सो दे मोस्ट ऑफ द टाइम क्रॉनिक केसेस में जो रेयर रेमेडीज है जहाँ पे आप सिमिलिमम फॉर्म करते हैं, दे ऐसा कहा जाता है कि दे आर हेल्प टू दैट ऑर्गन रिस्टोरेशन के लिए. जैसे अगर वो ऑर्गन बहुत ज्यादा डिजेनरेट हुआ है, बहुत ज्यादा उसकी खराबी आई है ऑर्गन में कि उसको उसके जो हेल्दी सेल्स है वो फॉर्म ही नहीं हो रहे हैं, तो दैट रेमेडीज हेल्प एट द डायनामिक लेवल to recover their healthy tissues. As we know, the homeopathic remedies are always help by balancing the vital force. Okay, that body cells are going to regenerate and they cured happen. So always remember कि कौन सी रेमेडी कब देना है, इसका अगर आपको कुछ प्रोटोकॉल रहता है, तो ऐसा प्रोटोकॉल एज सच तो ऐसा फॉर्म हुआ नहीं है. लेकिन आप अगर डॉक्टर बर्नेट का बेस्ट ऑफ बर्नेट पढ़ेंगे, तो ही यूज टू गिव रेयर रेमेडीज इन रिपीटेशन डोजेस, एंड देयर एक्सप्लेनेशन इज दैट कि ओनली दैट हेल्दी दैट टारगेट ऑर्गन की जो रेमेडीज है वो वहां पे हेल्प आउट करती है, उसके जो छोटे छोटे सिम्टम्स है वो क्लियर करने के लिए. सो देयर इज नो स्पेसिफिक रूल कि अभी आप रेयर रेमेडीज दो, अभी आप पॉलीक्रेस्ट रेमेडीज दो. नंबर ऑफ टाइम ऐसे होता है पॉलीक्रेस्ट रेमेडीज हेल्प दैट पेशेंट टू क्लियर अप ऑल द डिसीज कंडीशन एंड ही इज बिकम हेल्दी. एंड बहुत से बार ऐसे होता है कि आफ्टर चेंजिंग नंबर ऑफ पॉलीक्रेस्ट रेमेडी टू फाइंड आउट द सिमिलिमम, नो रेमेडी विल हेल्प. Or if someone is going to give a rare remedy on that small totality of indications कि उनका है कि पैथोलॉजिकली ये ऑर्गन डिस्ट्रैक्ट हुआ है, इसका पूरा डिजनरेशन होना शुरू हुआ है, उसको अपना स्टॉप करके उसको हेल्दी कंडीशंस में लाना है, तो दैट टाइम दैट सिंपल रेमेडी हेल्प्स टू रिकवर दैट पेशेंट, और पेशेंट की रिकवरी स्टार्ट होती है. अगर वो ऑर्गन रिस्टोर हुआ है तो फिर आप कॉन्स्टिट्यूशनल जो सिम्टम्स मैच होते हैं वो देना शुरू होते. So mostly rare remedies when we are going to give in respect with that target organ only, with finding the similarity, symptom similarity, all the stalwarts show the way that it is used in a lower triturations or mother tinctures. Okay, whenever, so ultimately is that whenever you have the thinking of using rare remedies and with the small number of symptoms and you have only target that organ only, जैसे for hepatosplenomegaly के लिए अगर आप सुन रहे हो कि सोच रहे हो आपको सिनेंथस देना है तो you should go with rare sorry low triturations so 1x 3x or Dr. Borik says कि mostly it is used in mother tincture to get good results. Okay, is it clear?
All right, sir. That's all the questions from today's
Okay.
session. And I think it's time to wrap up. And I would
Yeah.
like to thank you so much for presenting these rare remedies so well that I think from now we are not gonna forget these remedies. Thank you so much, sir, for giving us
I
your
take the
valuable time.
opportunity to thank Homeopathy 360 webinar series, all the mentors and all the committee members to give me the chance to share this small knowledge of mine and all the participants who are participate uh, in their busy schedule. Hope you all get something new or something interesting about Materia Medica. And it is good if you use this knowledge in patient for in disease condition and to make them healthy and having best wishes for upcoming Navratri. May Amba bless you with all happiness and prosperity. Thank you.
Thank you so much, sir. Sir, would you stop sharing your
Yeah.
screen for a little?
Right. Yeah.
So, sir, I would like to take a moment and will you please say a few words about the Homeopathy 360? How was your experience and how do you like the work of Homeopathy 360 about
Yes.
giving the webinars and the articles and blogs for the students?
Yes. It is my pleasure to share this that the Homeopathy 360 as a webinar series when I am approaching towards the Dr. Mansi Tyagi. Uh, that time she says that ki, sir, you have any international speaking experience or you have published anything about internationally or nationally. We always used to give the speakers or having platform for that person who are knowing well in the paternity of homeopathic field. So I just once says to her that, ma'am, if no one is going to chance to anyone, the first chance which is given to me by Dr. Mansi with the help of all their directorial board. I'm thankful to them that 360 homeopathy is giving the opportunity to all the homeopaths in their webinar to share their knowledge or present themselves in front of others rather than I'm saying that I'm not going to share my knowledge. I am going to share the what I have known from last 17 years from my practice because in this era number of people are not going to help you in respect with to promote you most of the time and we are thankful mostly I am thankful because this is my first webinar in my whole life and whole academic academic career that first time I am going to present myself in some other people to whom I don't know anywhere. I always give lectures to the college and all the I'm taking Viva and all the things, but I'm firstly express at this national level. I don't know from where the participants are there, so
So
they
from
may
all
get
over the India. We have attendees from different parts.
Yeah. And that's why I'm saying ki I'm first time nationally I'm presenting myself in front of other. Though with their all the schedules, busy schedules, they are arranging in numbers जितने भी आए होंगे. That will be motivate me that if I am going some sort of जिसको ऊर्जा बोलते हैं हम मराठी में कि उनको कुछ
जी
सीखने
सर.
के लिए नया पढ़ने के लिए अगर मैं कुछ बताना चाहता हूँ वो सीख सकेंगे क्योंकि homeopathy is not only ki we are going only by one path. You should take the holistic purpose. That's why all the stalwarts rare written rare remedies, rare prescriptions, all. So my request to all the homeopathic student to go through the literature which is given by stalwarts. So it helps you to make your confidence upbuild and it help you to forming your good homeopathic knowledge. And for that, 360 homeopathy is helpful because I always appreciate if I am going to give any lecture in further life in any at any stage. That time I am honorably what I'll say ki accept that the 360 homeopathy is the platform which is given to the me first time in my life, though I don't have any experience for giving webinar to the peoples. So thank you, Homeopathy 360 and BGen faculty for publishing articles of the student or physicians and doctors where they only uh, uh, send that articles that their website उनका पूरा एक प्रोटोकॉल रहता है हर महीने में कौन से डिसीज कंडीशन है कौन से इस पे आर्टिकल्स आने वाले हैं और उसके ऊपर आपने देने के बाद उसका पीर रिव्यूड होने के बाद दैट पब्लिश देयर आर्टिकल्स सो दे आर वेरी ट्रांसपेरेंट प्रोसेस they are not going to take anything from you. They always helps the homeopathic fraternity to upbuild their knowledge and share their knowledge to the all the people. So thank you once again for giving me this platform and hope I will continue with it if you are permitted me to give another webinar on another some sort of disease condition or anything if you want. Thank you.
Sir, thank you so much. Thank you so much for saying beautiful words for us. It's all thanks to you. You, sir, from your experience, we learn every day. And as it is always said, ज्ञान बांटने से ही बढ़ता है.
Yes,
And
definitely.
we all work in the vision of under the vision of Mr. Manish Jain, sir, the director of Vision Books. It's his
Thank you, Manish
vision.
sir.
Hey, sir, we should promote homeopathy as much as we can. And so here we are to help the homeopaths and as well as the students in the academic section and in the publication area. So thank you so much, sir, for giving us your time.
Thank you.
Okay, sir.
Thank you.
Thank you
Thank you
so
so
much, sir.
much.